Hello, everybody. This is Gabby Panetta from Find Your Inner Zen in Toronto, Canada. And I have the pleasure today to have a talk with Felix Umana from Umana Health in Toronto as well. Felix is a physiotherapist, and today we're going to talk about the importance of exercise because, as I always mention, exercise and movement is a really important thing to do for just moving our energetic field around and just clearing our energy. So Felix, thank you so much for joining us.
Thank you, Gabby, for having me.
Okay, so I know that you have a master's in physiotherapy, although you never talk about it, but you are quite knowledgeable in the human body and exercise in general. What exactly, and I know that Umana Health is very different from other exercise facilities. You are an exercise-based physiotherapy facility. Can you explain to me what is exercise-based physiotherapy?
Yeah, so I mean, in brief, physiotherapists can work in a wide variety of environments, as you know, in hospitals, long-term care, different things like that. In our setting, in our community environment, we've chose to specialize in exercise and movement. And what it means is essentially that the majority of our prescription is going to involve some kind of exercise or movement patterns that we'll kind of show our clients. And I have to say it that way because we obviously do a lot of different things, and it just makes it clear to people when they come in that they will have an experience that involves movement and exercise.
Okay. Now, what is the benefit of that type of approach versus a passive approach with just machines?
So, I mean, there's obviously lots of benefits to exercise, but traditionally, call it a 30-minute appointment. What would typically happen in a lot of physio clinics would be you would have 25 minutes of manual care, some mobilizations in your joints, they will move you through range of motion. And then at the end of that sort of appointment near the 25-minute mark, we would spend about 5 minutes with your physiotherapist, and they would say, okay, here's what I want you to do, Gabby, do this stretch, this movement, this and so forth. And then you go on and you kind of go and do it at home. Whereas in our approach, we probably spend about 5 minutes on the manual therapy, the stretches, and 25 minutes on actually showing you how to do the movement properly so that we know that when you go home, you actually have the knowledge on how to carry it out.
That's, of course, if I do them at home. Okay, so in physiotherapy, how do you just treat injuries, or what other applications are there for physio?
Yeah, and that's a big field that we're really trying to expand into because it's really untapped in our profession. Typically, anyone that says, "Hey, have you been to a physiotherapist?" Most people would say, "Well, I don't have an injury, so no, I don't. I've never seen one." So we're trying to shift that conversation to say, "Listen, why don't we see a physiotherapist before you're injured, and maybe they can pick up some things that you didn't know that might turn into an injury." And as we all know, it's not only more cost effective to do it that way on the healthcare system, but it's way easier to treat someone before they're hurt than when they're hurt.
Right, right. And it came to mind that it's easier to have a delivery if you're giving birth, if you've actually strengthened your muscles and conditioned for the delivery, than trying to recover after that.
100%.
Okay, so what benefits does exercise have on the body on a mental, emotional, physical, and energetic level?
Oh my goodness. I mean, we could go on for half an hour on this. So, I mean, and that's one of the reasons that really exercise is our main prescription, because if you look at any literature and you type in exercise for mental health, exercise for hormone rebalancing, you'll find tons of literature that shows it's all beneficial. Like everything kind of boils down to, yes, it's going to help you. And so that's why it is part of our main approach, because some of the other things we do, whether it's, stretching and soft tissue work, it could be kind of temporary, it can help, but in a long-term scenario, which is what we want with our clients, is we want to give them tools to really get a positive effect, not just in the half hour, but hopefully for the rest of their life. And exercise can really address all those topics that you just mentioned.
Okay, so what effects do you see these days with clients working from home, and how can exercise help them counteract the effects of work-related repetitive motion and really bad ergonomics?
Yeah, and that's a big thing. So it's a bit of a double-edged sword right now with a lot of people at home, and we thought it would give people more time because they don't have to commute anywhere. And so now you've freed up half hour of your day to, guess what, do something for your mental health, exercise, and so. But it's been the opposite. I mean, most people have actually ended up working more, which has ended up in people sitting down more, doing video conferences more, all that kind of stuff. So their health is kind of deteriorating a bit. And so we can step in a couple different ways. I mean, one of the easiest ways is we can assess people's workstations and say, hey, maybe you should modify this or do that. But we can also set them up on exercise programs and give them personalized stretches to say, maybe you should do this on a regular basis. Tell us what you have for equipment or anything at home, any space, and we'll design an exercise program based on what you have.
Awesome. See, I didn't even know that. Okay, so let's look at the scenario. I'm a middle-aged woman or man who's had kids, and they're now in their teenage years. And basically, I've neglected myself since they were born, and my husband as well. So I'm now entering menopause, and my husband's entering andropause. How can physiotherapy help me and him ease through this really important phase of hormonal changes that we're going to go through?
So yeah, from a hormonal perspective, I mean, some of the bigger challenges I think as we age is bone mineral and density, that kind of thing that it really is affecting as we get older. And so a lot of the research points towards exercise as a really big tool that we can use to really prevent that bone demineralization. And so that's a big aspect that I would think of the most majority of our sort of middle-aged clients that are dealing into that hormonal phase. But on top of that, I mean, if you've neglected your body for pretty much your whole life because you've been taking care of other people, most of the time, most people won't have the knowledge of where do I even begin? Like, where do I start? And so we help people with that as you come in and we kind of tell you, listen, maybe you should go to this direction because it's confusing right now. There's so much out there, right? You can go on YouTube, you can find people online, you can just walk down the street to a clinic. And so it's very difficult. It's the information age, but we got to be able to sift through what is appropriate for our clients. And that's where we kind of come in and help people.
Right. And every client I know is unique. And that brings me to the next question. So say, for example, I'm going through an autoimmune condition. How can exercise help me, deal with the symptoms and actually improve my health?
Yeah, and I mean, not just autoimmune, but yes, specifically for that, we do want to have the body be able to move around and have the body kind of explore movement patterns, joint range of motion, because it really helps the mind and the body connect in a way that really kind of creates this unison. I mean, autoimmune disorders, my daughter has one. They're very, very complicated. And there's a lot of factors that we still don't know. But what's important for the most part is having the mind in a good spot. And we kind of talked about the effects of exercise and mental health. Having that at least aspect that can calm the mind, it can affect the autoimmune response in our body as well. And so, having someone that can work with you, whether it's our physiotherapist here, like myself or someone else, and guiding you and making sure you're in a safe environment that you can do this, puts the mind at ease, puts the body in a better spot, and can a lot of times calm down the nervous system that can affect that too.
Right. Now, how do you determine the right exercise for every client that walks in?
So, I mean, we obviously, like you said, everyone's unique. So we always start with an assessment that includes joint range of motion, checking your current fitness level, having you move around a little bit, and obviously taking into account past medical history. If you have any issues that we might need to know, whether it's some hormonal issues or autoimmune issues, we factor that into our assessment as well. And then also looking at what your exercise history is. Do you have any relationship with exercise that you do a lot, you do a little, have you never done it? Once we have all that information, then we can really sit down, put it together, and just come up with a plan for every person that might be a little bit different. There's obviously some things that are very common for most people that we're going to do, but there are some things that, I mean, part of our job is to screen for things that may not be appropriate. So our biggest and foremost goal is do no harm and try not to get someone hurt. So it might be a lot of, hey, maybe don't do this kind of thing. So it's a lot of, yes, this is what you do, but also here's what you shouldn't do.
Great. And I know for myself on a personal level, I used to do yoga every single day. And I didn't know that because I have hyper flexibility, I shouldn't be doing yoga. So now, but I still need to stretch. So, but you've shown me what I can and cannot do, and that prevents injury for me. So
And that's a fantastic point. And it's, we try not to say, hey, don't do yoga, but it's maybe focus less on yoga and more on strength training, or less on strength training, more on yoga. People can be on different spectrums.
right. And that's see, many people don't know this. So let's just say that I'm one of those clients that never does my self-care at home or any exercises at home. What options do I have?
So we do offer actually virtual care, which has actually been fairly good for us in terms of our clients love the fact that they can do it at home in the comfort of their home with actual things that they have at home. Mm-hmm. And so not only does it allow us to create a program that makes it very intuitive for our clients to follow, but we have the accountability. So if you know that I'm going to join on Zoom next Wednesday and ask you, did you do your exercises, Gabby? I can tell if you did or didn't. So, that accountability is everything. And that's what this virtual physio does actually help, is just, we all need it. We all fall off. It's human nature to do that. So right. The accountability is probably the biggest part of it. And that's something we offer that's actually been very good for us and for our clients.
That's awesome. And it actually allows anybody from anywhere in the world to access your services, because they're not limited to having to come in person. So that's, okay. So after the initial assessment is done, how long would my sessions be? Are they always half an hour? Can they be an hour?
So when we do it virtually, it typically is half an hour. We've done up to 45 minutes. When it's in clinic, it typically is anywhere from 30 to 60 minutes, depending. Now, I'll be honest, it really depends on person to person. There are times where we just have to shorten the session and it's a 15-minute session. And the reason is the body's capacity just doesn't allow for more than that on certain days. So it is very individualized. On average, though, it is about 30 to 45 minutes that we work with our clients.
Wow. Okay. See, another thing I didn't know. All right. So let's talk a little bit about water and the importance of water for the human body, because, there's always something being said about water. But what I hear from clients is, yeah, but why do I have to drink water or fluids?
When we work with our clients, and that's another thing that it's a little different. A lot of times people go to physiotherapy, they don't sweat. They lay on a table and then they get worked on and then they leave. Mm-hmm. For us, it's very different. We actually have people come in gym clothes, get up a sweat, start, losing water, and we have to replenish that. And so by drinking water, both during the session or throughout the day, it helps us keep that hydration, which obviously is important for any type of function in our body, whether it's brain function, liver function, kidney function. So we do encourage our clients to really kind of stay hydrated throughout the day and keep on top of it. And actually, that's another what we found, and my wife being one of them, that she's at home and she says, wow, I don't drink enough water anymore when I'm home. Whereas at work, people are, there's a water cooler or there's a reason to walk around. So it's another very good point, actually.
Yeah, awesome. And I know that you offer throughout the day, there's now sort of just breakout sessions for people if they want to take a break from their daily routine, which they, now it's a little bit different. They can just join in your sessions. How do they access the Umana Health website to join in those sessions, or do they do it through social media?
Yeah, so in January, we started offering these movement classes because we've just seen such a great need for people to just have a reason to get up. Mm-hmm. And so we kind of came up with this midday mobility breaks that we throw in 3 days a week. And it's just one of our staff here, whether it's our kinesiologist, Camila, or Leo, the other physio, or myself. And we go through 10 to 20 minutes of just movements online. And they're accessed by our Instagram currently. We do throw them up on our YouTube channel when we can. And it's coming in February, actually. They'll be on Instagram and also on YouTube as well. We were playing around with the Zoom platform, but it just becomes logistically, it's a lot of cameras to have.
Right.
So we're going to stick with Instagram and also on YouTube, which makes it easy for anyone to go back anytime and play the videos.
And that's awesome. That means it's free.
That's completely free.
Oh, bonus. All right. Who would you say is your ideal client? Do you treat people only of certain ages? What is the range?
Yeah, we deal with a broad range, and more so now we're getting quite a bit more children, but our age range is from 5 to 80. And our ideal client is anyone that wants to move and have a great quality of life, because, people that are inspired that they want to get better either from an injury, or they want to try windsurfing this summer and they need the mobility to do that, or play golf. We have all kinds of different people, but the majority of our clients actually come in because they know that we're going to work with movement and exercise, and that's their health goal, is to be moving way into their 70s and 80s. And so, we
Right.
start young as 5 or 6, but we go way up to 75, 80 years old.
That's awesome. And that's important too. I don't know that people know how important it is for movement if you want to lead a pain-free late phase of your older years. It's yeah.
There's never, a lot of times people think, oh, it's too late for me. I'm 50, I'm 70. It's never too late. Is it harder? Yes, it's definitely harder, but it's never too late.
That's awesome. So can you give us one takeaway with regards to exercise to improve our health?
Yeah, the biggest one I tell everyone is consistency. It's not what you do, it's how often you do it. I could give you the best program and tell you, look, this is going to fix all your issues. And if you only do it once, it's garbage.
Of course.
We really try and say, and we try not to overload our clients as well, because everyone's going through a ton of stuff. So we try and keep it simple, start with 1 or 2 exercises. But the most important thing is, if I say do it 3 times a week or 4, you do it 3 or 4 times a week. Or if it's every day, it's every day. Right. So consistency is everything. And for exercise and obviously in life as well, as we all know, anything that we're doing, if you're consistent, you usually get results.
Right. That's awesome. So Felix, how can people contact you and the Umana Health facility if they want an assessment or if they want a consultation?
Yeah, so the easiest way is to go online. We have a pretty decent website that's just uhealth.ca. That's the letter U, health.ca. And you can find all the information on there, and you can just book online. It makes it super convenient for everybody to check our live schedules for everyone that works here. Awesome. And then you can check us out on our Instagram, social media, Facebook, at Umana Health. We're on there as well. So feel free to message us, or the old school way of calling. Just call our phone number and talk to Cadella, who's amazing. She's our office administrator here.
Awesome. Thank you so much. I know you have a really busy schedule, but I do appreciate this because it's important for everybody to just move the body, shift the energy around, get rid of all the stress, and live a healthy life. So thank you so much.
Thank you, Gabby. It was great chatting with you.
Same here. Bye-bye.
Take care. Bye.